Welcome to your personalized deep dive. Today we're diving into the world of canine cardiology, specifically a potential rescue protocol using TEE in dogs during anesthesia. Yeah, transesophageal echocardiography.
Right.
Our source is this really cool research article straight from the American Journal of Veterinary Research.
Yeah.
It's titled, A Proposed Rescue Transesophageal Echocardiographic Protocol for Anesthetized Dogs.
Catchy.
I know, right?
So what's the deal with this rescue protocol for dog hearts? Why would we need that during surgery?
Exactly. Like, what kind of situations would this even be helpful for, you know?
Well, think about it this way. Imagine a dog is in surgery for a routine spay.
Okay.
Suddenly, their blood pressure just tanks, or their heart rhythm goes haywire.
Oh, wow.
Yeah, it's a total race against time to figure out what's going on and get them stable again.
That sounds intense.
It is. And in human medicine, that's where this rescue T comes in.
So we're talking about those critical moments when a dog's heart just throws a wrench in the works during surgery.
Yeah, even if the surgery itself has nothing to do with the heart.
Interesting. So this protocol basically aims to give vets a quick and focused way to check the heart in those moments.
Right. And then use that information to make those life-saving decisions about treatment.
Okay, that makes a lot of sense. But how does this protocol actually work in practice? What are the main parts?
The core of it is a series of 3 specific views of the heart.
Views.
Yeah, we get them using a T probe. Think of it like a tiny camera on a flexible tube that we insert down the esophagus to get those close-up images of the heart.
Oh, I see. So it's like we're getting a live internal view of the heart right in the middle of surgery.
Precisely.
That's pretty amazing. What are those 3 views, though, and what makes them so important?
All right, so the first one is called the mid-esophageal 4-chamber view, or ME4C.
ME4C. Got it.
As you might guess from the name, it aims to capture all 4 chambers of the heart.
All 4?
Yeah, the right and left atria and the right and left ventricles. We can see the mitral and tricuspid valves, too.
And those are the ones that control blood flow between the chambers, right?
You got it.
So the ME4C basically gives a good overview of the heart's structure and function.
Okay.
What about the second view?
Next is the mid-esophageal long axis view, or MELAX. This one focuses on the left side of the heart,
Okay.
including the aorta.
Which is the main artery carrying that oxygen-rich blood to the body, right?
You know it. This view is super important for assessing how well the heart is pumping.
Gotcha. And what about the third view? I've heard this one is a bit tougher to get.
That's right. It's the caudal esophageal short axis view, or CE SAX. This one tries to capture a cross-section of the left ventricle.
The left ventricle.
Yeah. The heart's main pumping chamber.
At the level of the papillary muscles.
That's at it.
Hold on. Papillary muscles. Remind me what those are again.
They are these little but powerful muscles within the heart that help control how the mitral valve opens and closes. Getting this short axis view helps vets assess the size, shape, and contractility of the left ventricle.
And those are all super important for understanding how well the heart is working. But why is this particular view so tricky to get in dogs?
Well, it all boils down to anatomical differences between dogs and us humans. You see, in humans, we often get this short axis view through the stomach.
Through the stomach.
Yep, it's called the transgastric approach. But for dogs, the distance between their stomach and their heart makes that approach pretty difficult.
So vets have to go through the esophagus instead.
Exactly. They maneuver the probe down the esophagus almost to the stomach and then angle it to try to get that cross-section of the left ventricle. But even with all that fancy maneuvering, getting that perfect short axis view where the left ventricle looks like a perfect circle isn't always possible in dogs.
I see. So we have these 3 views, each giving us unique information about the heart. But how did these researchers go about testing this whole protocol?
They did a study using 8 healthy beagles. Yep.
All the dogs were under general anesthesia and lying on their backs, which is a typical position for surgery. A really experienced veterinary cardiologist performed the T-scans. And then later, 2 other experts reviewed all the images to make sure everything was accurate and consistent.
That's a really thorough way to figure out if this protocol is even feasible.
Absolutely. And now let's dive into the results. How well did these views actually work in practice? Were they able to get those clear diagnostic images? That's where things get really interesting. So the ME4C and MELAX views, those were actually pretty easy to get, even with the dogs under anesthesia.
No, it's good to know.
Yeah, the images were nice and clear, allowing for good visualization of the heart chambers, valves, and even the aorta.
So veterinarians could reliably get those two important views even in a really tense situation. What about the CE SX, though? The one that's trickier because of the anatomical differences we talked about.
Right, so as we expected, the CE SX was definitely the most challenging to acquire.
Remember how we were talking about that gap between the diaphragm and the heart in dogs?
Yeah.
Well, that gap is filled with, you guessed it, lungs.
Oh, right, lots of air in there.
Exactly. And air, unfortunately, does not play nice with ultrasound waves.
So it makes it hard to get a clear picture of the heart.
It does. Those sound waves, they just bounce right off the air, creating a lot of interference.
So even with careful positioning, you can't always get that perfect short-axis view.
That's right. And for a veterinarian in a really high-pressure situation, not having that perfect image could make it harder to really assess how well that heart is pumping, which could delay those critical decisions about treatment.
That makes sense. But even if the image isn't perfect, can vets still get some useful information from the CE SSX?
Absolutely. While certain precise measurements, like the ones we use to calculate ejection fraction, might be a little bit iffy because of the image quality, I think subjective assessments are still likely reliable. Vets can still look at how the heart walls are moving and spot those abnormalities that could signal a problem.
So even without a textbook perfect image, vets can still get those important clues about the heart function from the CE SX view.
You got it.
Speaking of clues, I know the researchers also use color flow Doppler imaging in this study. What did that show?
Color flow Doppler. Well, it's like adding another layer of detail to the ultrasound picture. It lets us see how the blood is flowing within the heart.
Oh, wow, that's cool.
It is. And it can help us see if any valves are leaky or if there are any strange flow patterns going on. Now, here's the interesting part. They actually found some unexpected mitral regurgitation in a couple of the dogs.
Mitral regurgitation?
Yeah, basically a leaky mitral valve.
Wait, even though these were healthy beagles?
Right. And none of them had any heart murmurs before the anesthesia.
So what does that mean?
Well, it suggests that there might be some underlying cardiac issues that only show up under certain conditions, like anesthesia or if they're given certain medications.
So this rescue T protocol, it has the potential to uncover hidden heart problems that might otherwise go totally unnoticed during surgery.
Exactly. Having this tool at our disposal could give vets a way to identify and manage these issues before they turn into a real crisis.
That's amazing. Now, this research was done in healthy beagles. What are the next steps for turning this protocol into something practical for everyday use in veterinary practice? What other research needs to be done?
That's the million-dollar question. We need to know how this protocol performs in a wider variety of dogs, right? Different breeds, sizes, ages, and especially those with pre-existing heart conditions.
Because a Chihuahua and a Great Dane, they're going to present very different challenges for positioning that T-probe.
Exactly. Anatomical variations are a big factor. And then we also need to consider the practical stuff, like how does using this protocol in a busy surgical setting affect patient care?
Right.
Does it actually lead to better outcomes? And then there's the training aspect. How do we train all the veterinary anesthesiologists out there to perform and interpret these T scans quickly and accurately, especially in those super stressful situations?
I imagine that would take a lot of specialized training.
You're right. It could even mean developing new training programs, maybe incorporating T simulation into vet school curricula.
So lots to explore, but it definitely sounds like this research has opened up some exciting new possibilities for how we care for our canine patients during surgery.
Yeah. And speaking of exploring further, I thought it was really interesting how the researchers dove into the anatomical differences between dogs and humans, particularly in relation to that tricky caudal esophageal short-axis view.
Yeah. They compared CT images of a dog and a human, right, to try to figure out why getting that CE SAX view is so much harder in dogs.
Exactly. And what they found really highlights this key anatomical difference that I think helps explain why that caudal esophageal short-axis view is so hard to get in dogs. So they took these CT scans to get a really detailed view of all the structures that are around the heart.
And compared dogs and humans.
Side by side.
Wow, that's cool.
It is, and it highlights this key difference anatomically between the two that I think really explains why that CE SAX view, that caudal esophageal short-axis view, is so hard to get in our canine patients.
Okay, I'm all ears. What did they find in those CT images?
Well, Try to visualize this. In humans, when we're going for that transgastric short axis view, the stomach is right up against the diaphragm,
Okay.
and the diaphragm is snug against the heart.
So there's a nice clear path for those ultrasound waves to travel through.
Exactly. But in dogs, there's this big gap between the diaphragm and the heart.
There is. What's in that gap?
What do you think?
Lungs.
Oh, right. The lungs. But lungs are mostly air. Yeah?
Yep. And air, my friend, is like the kryptonite of ultrasound imaging.
No.
Yeah. Those sound waves just bounce right off the air. It creates so much interference, making it almost impossible to get a clear picture of the heart.
Ah, so that's why trying to get that short axis view through the stomach in dogs is usually a no-go. Too much air in the way. That's the burning question. And that's why these researchers went with that caudal esophageal approach, where the probe is closer to the heart,
Right.
minimizing the amount of lung tissue that gets in the way.
Smart. So it's like they're strategically getting around those air-filled lungs, trying to get that best possible view.
Precisely. It's times like these that I'm really reminded of just how ingenious veterinary medicine is, constantly adapting techniques based on the unique anatomy of our patients.
Well, this has been an incredible deep dive. We've gone from human emergency medicine to the anatomy of dog hearts. And we even learned about this potential new tool that could change how we practice veterinary medicine.
I think it just goes to show how much we can learn from each other across different species and different areas of medicine. But at the end of the day, it's always about improving the lives of our patients.
Right. Couldn't have said it better myself.
Yeah.
So for all our listeners out there who are already thinking about how this research can change their own practice, what's the one question they should be asking themselves going forward?
Well, I think the most important question to think about is this. How could having this kind of rescue protocol available change how we as veterinarians deal with unexpected complications during surgery?
Oh, that's a good one.
Yeah. Would it mean we could find problems sooner, intervene quicker? Could it even save lives?
Such important questions to consider. It really is amazing to think about how much of an impact this research could have on the future of veterinary medicine. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.